Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and this is quite convenient to study. I hope you will make use of it. My dear friends, we have been discussing about the bleeding and clotting disorders in children since last two classes. In the last class, we have seen the functional platelet disorders, which is very typical. And today, we shall see the difference between the platelet disorders or coagulation disorders. This can be also labeled as difference between the bleeding disorders and clotting disorders. Okay, of course, bleeding can occur in platelet problem and bleeding problem, in coagulation problem both, or clotting factor problem both. So bleeding is possible even in platelet disorders, and it is also possible in case of a clotting disorder problem. Okay, so therefore it is better to classify it as platelet disorders and coagulation disorders. So we cannot have a fixed idea in our mind that bleeding disorders means platelets, clotting disorders means coagulation problem. That means coagulation factor problem. It is not like that. So bleeding can occur in both the cases. So let us identify two important causes of the bleeding. So one is platelet disorder and another one is coagulation disorder. So coagulation disorder, as the name suggests, the problem will be there in the clotting factors. There may be clotting factor deficiency, or there may be clotting factor stability problem. Okay, so there may be absence of some of the clotting factors in between. So like this, there are many problems out there that we will see one by one. But now, what is the basic difference between the platelet disorders and coagulation disorders when you examine the patient? Okay, of course, investigation is there. Definitely, we will going to find out what is the real cause by various investigations. But at the OPD level, clinically, when the patient comes to you, by the first view itself, how you can identify whether this is a bleeding because of platelet problem or coagulation or clotting factor problem. Okay. So let us see, in case of the platelet disorders, as I already told, the bleeding is because of either qualitative or quantitative problem with the platelets. Platelets number is less, number one. Number two is platelet number is normal, but functional capacity of the platelet is down. So this may lead to the bleeding. This is the major cause of bleeding in case of platelet disorder. So where actually bleeding occurs in case of platelet disorders? In the platelet disorders, the bleeding is most commonly seen in the skin and mucous membrane area. It occurs in the superficial area of the body. It is superficial bleeding. It is not a deep bleeding. It is the superficial bleeding. Suppose if you see in case of now dengue, when the platelet count comes down, we will have superficial bleeding sites. Okay, maybe in the skin, maybe in the mucous membrane, maybe in the angle of the mouth, like that. Okay, it's not deep artery bleeding. Okay, so it's a superficial bleeding, and the skin and mucous membrane is the most common site. But whereas clotting factor problem, when it occurs, it's not a superficial bleeding. You cannot see any bleeding sites superficially in the skin. It is actually the deep bleeding. Bleeding occurs in the deeper parts of the body. So most commonly this can occur either in the joints, maybe most commonly the pressure sustaining joints like knee joint, elbow joint, shoulder joint, or maybe the hip joint, etc. So it's a deep bleeding. Okay, so blood is get oozed out of the vessel and get collected within the body itself. Within the body itself, it get collected, leading to a swelling. So it's basically a deep bleeding, either in the joints or maybe in the muscles. Now, what are the types of bleeding in case of platelet disorders? In platelet disorders, the bleeding points which occurs can be classified as petechial patches, purpural patches, and if it is still bigger, it is ecchymosis. Now, petechial means if the size is less than 1 mm, then we will call it as petechial. If the size is more than 1 mm, then we will call it as purpura. And if it is still bigger, involving the larger, more space, surrounding space, then it is called as ecchymosis. Okay. Most of the time in case of the platelet disorder, the bleeding is always sudden and at a spontaneous onset. Suddenly, for example, you take the example of platelet disorders. like thrombocytopenic purpura, idiopathic, where the bleeding starts in the form of the purpura or ecchymosis. So the ecchymosis or purpura, it is very sudden, spontaneous onset. There was a history of fever about 10 days back, then suddenly the bleeding starts. Okay, so that means because of autoimmune pathologies. Anyway, therefore it's a sudden and a spontaneous onset. But when you talk about the clotting factor problem, coagulation disorders or clotting factor problem, the bleeding is not so sudden. Bleeding is not so sudden. There will be history of injury. There will be history of injury. Maybe 1 day back, 2 day back, or 3 day back, or 4th day onwards, you find some swelling in the injured area. Okay, that means bleeding is quite slower. It's not sudden because platelets are normal. Only clotting factor problem is there. So initially the primary hemostatic plug is formed, but it does not get stabilized later onwards. So therefore, there also the bleeding starts in the later part of the injury. Okay, so there will be history of injury 1 day back or 2 or 3 or 4 day back, followed by a swelling. Most commonly, swelling will be in the pressure points. For example, pressure sustaining areas like knee joints, maybe the elbow joint, shoulder joint, hip joint, etc. Okay, so hemoarthrosis means in the joints, collection of the heme around the joint space. So that's called as hemoarthrosis. There may be formation of hematomas in the muscles. In the muscles, if you're talking, it may be hematomas. So this is the pattern. In the clotting factor deficiency problem, clotting factor problem, always the onset of the swelling or onset of the bleeding is quite slower. It's not sudden. Whereas in case of platelet problems, it always suddenly occurs. Now, in case of the platelet disorders, the bleeding can be there in the skin, mucous membrane, superficial area, etc. But the other form of the blood loss can be also seen. For example, there may be bleeding that means blood can be passing through the urine also, leading to hematuria. Okay, so if in case of adolescent girls, excess menstrual loss of the blood may be there. Okay, so that means after the menstrual loss of the blood, it is not get completely recovered. Rather, the bleeding will be prolonged. Okay, because that arteries which are shed off, so they has to stop the bleeding, isn't it? But here the bleeding is not stopped because of platelet problems. So there may be gum bleeding, and there may be melena, stool mixed with the blood, and even the nasal bleeding, epistaxis. So these are the other presentations. These are the other presentations of platelet disorders. Apart from skin and mucous membrane superficial bleeding, it may be also hematuria. There may be excess menstrual flow of the blood. There may be gum bleeding. There may be nasal bleeding in the form of epistaxis. Whereas in coagulation disorder, clotting factor problem, it is not like that. There will be either hemoarthrosis, hematoma, or collection of the blood in any of the loose area or tissues of the body or loose areas of the body, leading to a swelling, leading to a painful swelling. Sometimes it is painful, sometimes it is painless. Now, in case of the platelet problems, if you see the bleeding time on investigation, bleeding time is prolonged. And it is quite natural because primary hemostatic plug itself is not formed, therefore bleeding time will be prolonged. Although in clotting factors, the bleeding time is not increased. Okay, bleeding can occur in both platelet and coagulation problems. This I have discussed in the first itself. But their severity and pattern will be changed. Okay, so this is in case of platelet disorders. In the platelet disorders, always you will going to get prolonged bleeding time. The reason is platelets are very much important, activation, aggregation, etc. It is very important for the formation of the primary hemostatic plug. When the platelets are itself not there, or functional or structural problem is there, then the primary plug itself is not formed, temporary plug is not formed, so definitely bleeding time will be prolonged. But bleeding time can be also prolonged in case of a clotting factor also. That you have to keep in mind. Okay, so of course the severity will go to change. Suppose the platelet problem is there, but clotting problem is not there. Although there is bleeding, the severity may be less. Okay, so that's the issue. Now talking about coagulation disorder or clotting factor disorders, bleeding time may be get prolonged. Severity differs, but clotting time is prolonged. Definitely clotting time is prolonged. Okay, so bleeding time is normal. clotting time is prolonged, bleeding time may be normal or maybe slightly, in some conditions, slightly may be deranged. Otherwise, most of the cases, bleeding time is normal, only clotting factors are get prolonged. Clotting time is get prolonged. While clotting factor deficiency, in case of clotting factor deficiency or in coagulation problems, okay, so that will be identified by the prothrombin. Now, actually, when we talk about clotting factors or coagulation problem, in the coagulation there are two important pathways are there. One is extrinsic pathway, another one is intrinsic pathway that we will discuss. Okay, so usually in clotting factor problems, both these pathways leads to the activation of the prothrombin. That means if the prothrombin time PT is increased, it suggests that in the clotting factor problem, extrinsic pathways get affected. Okay, so if APTT, activated partial thromboplastin time, if that is increased, it suggests that intrinsic pathway of the clotting factor is get affected. In the clotting factor cascade, coagulation cascade, we have got two pathways. One is extrinsic, another one is intrinsic. Both has to work together. Okay, ultimately both will go into activate the fibrinogen to form the fibrin. Okay, so now in the clotting factor problem, we have got two things. The problem may be because of extrinsic pathway, problem may be because of intrinsic pathway. If extrinsic pathway problem is there, among the clotting factors, prothrombin time will go into increase. If the intrinsic pathway problems are there, among the clotting factors, that is activated partial thromboplastin time will go into, APTT will go into increase. So this is a basic information. We will discuss how this is possible, why it is increased, why it is decreased. That we'll see in the coming classes. Now, see, this is a presentation of the patient in case of clotting disorders, clotting factor problem, where internal bleeding takes place, deep bleeding takes place. Okay, so it's not a sudden onset, slow onset. After the injury, 2 or 3 days later, you will have the swelling. Most commonly, if you see in this patient, first picture, there is a hemarthrosis in the knee joint. Okay, probably that child would have been gone through a injury to the knee joint 3 or 4 days back. Then there on slowly there is a collection of the fluid because of the clotting factor deficiency. Clotting factors are not able to stabilize the hemostatic plug. Okay, and as a result, the bleeding is on. Okay, although temporary plug is formed, the bleeding is on because it is not strengthened. In the second picture, again in the elbow joint, we have got hemarthrosis. Here also we will have hemarthrosis. This is a presentation in case of clotting disorders. This particular swelling may be painful, may not be painful. Most of the time it is not painful. But when it start compressing the joint articular area, there may be pain. Now this is a presentation in case of a bleeding disorder, or what you say, platelet disorders. This is a presentation in case of platelet disorders. See, this is superficial bleeding. Okay, skin is get affected. Okay, now 3 presentations are there. See, first one is petechiae, where petechiae is less than 1 mm, spots are there. That's called as petechiae. Okay, when 2 spots are merged together and it has become more than 1 mm, then it is called as purpura. And the middle picture is a typical of ecchymosis. Larger areas get affected, ecchymosis. All the 3 pictures are suggestive of a platelet problem. And this is petechiae or ecchymosis, which is commonly seen. Now let us have the case number 1. Now see, a 7-year-old boy by name Raghav was playing in the ground last day and had a small fall in his right knee while playing. Okay, so he didn't had much pain and recovered from it and continued to play for next 1 hour. थोड़ा बहुत उसको चोट लग गया था, उसके बाद 1 घंटा उसने रेस्ट ले लिया, उसके बाद वापस वो खेलना शुरू कर दिया. And he also had a very sound sleep at the night. कोई प्रॉब्लम नहीं है, पेन की वजह से कोई ऐसा डिस्टर्बेंस नहीं था. In the next morning, when he is not able to get up due to some pain or what you say swelling in the right knee joint. On examination, there is a reddish swelling which is boggy in nature and was taken immediately to the doctor. Previously, he had a history of similar swelling in the right elbow joint. ऐसे ही एक बार वापस पहले भी जो एक बार उसको चोट लगा था, तो उस टाइम में भी जो है उसको ऐसे ही हुआ था और ऐसे ही ट्रीट किया था, सही हो गया था. That means he had got a recurrent history. Okay, that means this boy has got the clotting factor problem. Okay, this is typical hemarthrosis which is happening. On investigation, the bleeding time is normal. Yes, it may be normal. Bleeding time is absolutely normal, but the problem is with the clotting factors. Okay, so diagnosis is very clear. This is a clotting problem. Okay, clotting or clotting factor deficiency problem. Now we have to see whether it is intrinsic pathway or extrinsic pathway for the by next further investigations. So this is a case number 1. Talking about this case, a 9-year-old male child by name Shailendra was a well-looking happy boy. One day he noticed small reddish point-like spots in the lower limb. मदर सेज इट वॉज नॉट देयर 1 वीक एगो, एक हफ्ता पहले मदर ने देख चुका था उसका, तो उस टाइम में कोई ऐसी स्पॉट्स नहीं था, बट अभी जो है सडनली 9 साल का बच्चा है उसको ये बॉडी में लोअर लिम्ब में स्पॉट्स आ रहे हैं, रेडिश स्पॉट्स हैं. सिंस लास्ट 1 वीक ही गोज ऑन, एक हफ्ते में सिंस द लास्ट 1 वीक इट गोज ऑन इंक्रीजिंग, एंड लास्ट डे ही हैड एपिसोड ऑफ नोज ब्लीडिंग ऑल्सो. ऐसे एक हफ्ते से चल रहा है, धीरे धीरे स्पॉट्स बढ़ रहा है, और कल जो है उसको नेसल ब्लीडिंग, ही आल्सो हैड द नेसल ब्लीडिंग एपिस्टैक्सिस. स्पॉट इज पेनलेस, स्पॉट जो है वो पेनलेस है एंड देयर इज नो इचिंग एक्सेट्रा, अदरवाइज चाइल्ड इज कंफर्टेबल. नाउ लेटर ही वाज टेकन इनटू अ हॉस्पिटल एंड द ब्लीडिंग टाइम वाज डन. तो डॉक्टर ने देखा, सो डॉक्टर वाज सस्पेक्टेड सम ब्लीडिंग और प्रॉब्लम, क्लॉटिंग प्रॉब्लम, सो ही हैज गॉन फॉर अ ब्लीडिंग टाइम. ब्लीडिंग टाइम इज प्रोलॉन्ग्ड. What about the clotting factors? Clotting factors में कोई information है. Probably clotting factors are normal. Okay, but bleeding time is definitely increased. He had the history of upper respiratory tract infection 15 days back. When we ask further, he had a history of upper respiratory tract infection 15 days back, which was cured by some of the medication. Now the diagnosis. What is the diagnosis? Now here, he had a history of upper respiratory tract infection 15 days back. That means he had a viral infections, and that was treated and cured. But a viral infection is always known to exaggerate the body immune system. So there may be formation of some of the auto-antibodies, probably. So gradually the auto-antibodies level will going to increase. Auto-antibodies against the platelets. Okay, there are certain auto-antibodies are produced against the platelets. Now these produced by our own body immune system as a reaction to that particular upper respiratory tract infection by the virus. Okay, now these antibodies which is targeted against the platelets, they start attacking the platelets, and platelet counts comes down, and as a result when it considerably comes down less than 2.5, then there is a appearance of the spots. Okay, so when we go for the bleeding time is increased. That suggests that definitely there is a platelet problem. Platelet problem means problem may be in the function of the platelets, or maybe in the structure of the quantitative problem. Now in this case it's a quantitative problem because antibodies are killing the platelets. Condition may be called as idiopathic thrombocytopenic purpura. So this is a purpura, therefore purpura means it is a bleeding problem. So purpura means it's a platelet problem. P for P, purpura means always a platelet problem. So this is a case number 2. So this is how we have to identify the bleeding disorders, that is platelet disorders and clotting disorders clinically. The rest of the things in detail about this approach to a patient of platelet and clotting factor deficiency disorder we will discuss in the further classes. So this is just to give idea that superficially how to differentiate a platelet disorder, a bleeding due to platelet disorder and bleeding due to clotting disorder problems. In the next class onwards we will go for the detailed explanation of all these problems. Thank you very much.